Hi, my name is Tiffany Flores, and today we're going to be talking about heroin. What is heroin? According to the CDC definition, heroin is an illegal, highly addictive opioid drug. It is made from morphine. It can be either white or brown in color. It's typically a powder or a black sticky substance, which can also be called black tar heroin. It is typically injected, sniffed, snorted, or smoked. Other common names it is known by is Big H, horse, hell dust, or smack. Prevalence. Heroin use has increased sharply across the U.S. among both men and women, most age groups, and all income levels. The greatest increase was seen in demographic groups with historically low rates of heroin use, women, privately insured people, and people with higher incomes. According to the National Survey on Drug Use and Health, in 2016, there was about 948,000 Americans who used heroin in the past year, and most of them fell under the young adult category, ages 18 to 25, and also 17,000 that started to use heroin in 2016. That number nearly doubled the number back in 2006, which was 90,000. And here is a graph for a better perspective of these numbers. Statistics. There were nearly 5 times the number of heroin-related overdose deaths in 2018 as there were in 2010. Overdose deaths increased from 3,036 in 2010 to 14,996 in 2018. From 2017 to 2018, the heroin overdose increased by over 4%. Effects. So when heroin enters the body, it also enters the brain very fast because it binds to opioid receptors on cells located in many areas, especially those involved in feelings of pain and pleasure, and in controlling heart rate, sleeping, and breathing. Some short-term effects of heroin can be dry mouth, warm flushing of the skin, nausea, heavy feeling in arms and legs, severe itching, clouded mental functioning, and back and forth state of being conscious and semi-conscious. Long-term effects can be insomnia, collapsed veins for people who inject, damaged tissue inside nose, infection of the heart lining and valves, abscesses, which is swollen tissue filled with pus, constipation and stomach cramping, liver and kidney disease, lung complications, mental disorders, and sexual dysfunction for men. And then here's another picture of heroin, of what you feel when you're high on heroin. So some psychological effects are euphoria, pain relief, disorientation, and calmness. Other potential effects. Since heroin contains additives such as starch, sugar, and powdered milk, it can clog blood vessels that lead to the lung, liver, kidneys, or brain, and this causes impairment damage. And it also increases risk of infectious diseases and death of small patches of the cells in vital organs. Risks. One of the risks mentioned before was overdose. Depending on how severe the overdose is, if it's mild, it can slow and shallow breathing. Medium or middle can cause a coma, and higher overdose can cause death. Another risk is long-term or serious viral infections, which was also mentioned before, such as HIV and hepatitis, as well as other bacterial infections of the skin, bloodstream, and the heart. Lastly, another risk is addiction. And then with addiction comes withdrawal symptoms. Some can be restlessness, severe muscle pain, sleep problems, diarrhea, cold flashes, uncontrollable leg movements, and severe heroin cravings. Treatment. Naloxone is a medicine that can treat opioid overdose. More than one dose may be needed. It can be injected or used as nasal spray. And the second treatment option is behavioral therapies. Here are my references. Thank you for listening.